It is the intention of the government to second staff to the Okeu complex effective April 1st, 2020. Options were provided to CSA member staff at Victoria Hospital to be seconded to the Millennium Heights Medical Complex. However, according to General Secretary CSA Claude Paul, its member staff may face a delay in moving in. He says members are calling for clarification.
The difficulty we have found so far is that there's no explanation of what terms and conditions that those members will be going into. And of course, our members are a little reluctant, given that the information has not been made available in a way that they can actually make an informed decision.
The Ministry of Health has given staff the option of agreeing to be seconded at their current posts for an initial period of 2 years, after which the secondment could be renewed for an additional 2 years. Those who choose not to be seconded to the Okeu complex can be absorbed elsewhere in the public service. Paul says members want a third choice.
I think in general, we want to ensure that jobs are protected, where pensions are applicable, these are preserved. And I think all these are mentioned in the Millennium Heights Act in legislation. And so we just want to be sure that everything is in order and that there's no mischief and that the jobs are protected.
Furthermore, the issue has been compounded given the threat of COVID-19. Many medical professionals have come out against the idea of using Rat Island as a quarantine zone. Therefore, the focus has been placed on Okeu to act as a quarantine center. However, with staff now requiring some level of clarification, we are unsure about when that date will be for when they move into that new hospital.
The Okeu in whatever condition it is at the moment would be much better than what obtains at Victoria Hospital, and therefore it does not pose any additional hazard to go to the Okeu. I mean, it seems to be a reasonable position, and I think as a Saint Lucian, as a citizen of Saint Lucia, I welcome any move that will bring about an improvement in the healthcare situation. But as I say, as a trade unionist, our concern will remain the interests of our workers and to ensure that no one is disadvantaged as a result of whatever is taking place.
At the end of the day, Paul says the best interest of the staff is paramount. He reveals a letter outlining the concerns of the CSA members has been sent to the Ministry of Health, and they are awaiting feedback. In November 2019, the government, through Parliament, passed an amendment to the Millennium Heights Complex Act, stating revisions concerning the use of the term second rather than transfer were made to ensure the bill was in keeping with the Pensions Act. Solange Alfred, HTS News Force.